Hello everyone, this is Surendran's YouTube channel. Today I'm going to talk about kidney failure. So kidney failure is also known as acute kidney injury. Acute kidney injury, there are three categories or can be said three locations where there are possibilities of kidney failure. The first one is pre-renal, before the kidney. The second one is intra-renal, inside the kidney or within the kidney. The third one is post-renal, after the kidney. Acute kidney injury (AKI) is also known as acute renal failure or ARF. The hallmark manifestation of kidney failure is known as renal azotomia. Renal azotomia is an intrinsic kidney disease where there will be rise in blood urea nitrogen or known as BUN and creatinine. The increase in blood urea nitrogen, BUN and creatinine are the main cause of acute kidney injury or kidney failure, and these two things represented by low glomerular filtration GFR. So what is GFR? GFR is not, in simple words, can be said as total filtration rates of blood by the kidney, of blood by kidneys. Now let's look about pre-renal acute renal failure or pre-renal kidney failure. This occurs due to substantial decrease in blood flow to the kidney and also blood pressure to the kidney. So this can happen due to heart failure and excessive bleeding inside the body. There are two causes that can be related to blood reduce in or decrease in blood pressure to the kidney, which are sepsis and anaphylaxis. Sepsis and anaphylaxis will reduce the vascular tube's capacity, which carries blood to the kidneys, leakiness in vascular tubes, and also blood loss from the vessel. So whenever there is a reduction in blood pressure or a decrease in blood pressure to the kidney, we can often relate it to sepsis and anaphylaxis. The second cause can be related to renal artery stenosis. Renal artery stenosis are narrowing of arteries that carries blood to the kidney. This can be related to this artery, the narrowing of this artery that become a pathway that carries blood to the kidney. So this renal artery stenosis can be caused by fibromuscular dysplasia. Fibromuscular dysplasia is an abnormal growth in artery walls. It's a condition where blood vessel that carries blood to the kidney starts to narrow. So we can say whenever there is a fibromuscular dysplasia, there is an abnormal growth in the arteries wall that reduce the diameter of the arteries that carries blood to the kidney. So this is one of the cause for renal artery stenosis. Whenever there is a such condition like renal stenosis, fibromuscular dysplasia or narrowing of arteries, there will be reduced or decrease in blood pressure and also blood flowing capacity or blood flow to the kidney. So decrease in blood pressure and in blood flow to the kidney will trigger the activation of renin-angiotensin-aldosterone system or RAS. Renin-angiotensin-aldosterone system is a hormone system within the body which is essential for blood pressure regulation. In easy words, we can say whenever there is a decrease in blood pressure to kidney, this RAS, renin-angiotensin-aldosterone system, will be activated to increase the blood pressure to the particular hormone or kidney. Whenever there is an activation of RAS, higher amount of aldosterone system will be released for reabsorption of higher amount of sodium and also water to the blood. As we can say, this is a small drawing. This is a nephron and this is a glomerulus. I never draw the whole nephron, so this is just a one part of the nephron. So whenever there is a blood flow from the afferent artery, then blood flow out from the afferent artery. So whenever there is a blood flow through the afferent artery, the BUN, blood urea nitrogen, and creatinine are filtered through these nephrons. This BUN will be reabsorbed into the artery, and this creatinine cannot be reabsorbed into the artery. So this is a simple drawing of a nephron and also glomerulus. Glomerulus is network of small blood vessels. These sites of the nephrons are built up of tubular epithelium cells. This is a healthy tubular epithelium cells. I can say it is healthy because there is no space and these tubular epithelium cells are arranged in sequence, or there is no space between tubular epithelium cells. This forms a layer to enable for reabsorption and also other filtration process. Now let's look at intra-renal acute renal failure or intra-renal kidney failure. This can related to internal structures of kidney are damaged due to ischemia. Ischemia is a state of condition where insufficient amount of blood supplied to the kidney, which can be resulted in acute tubular necrosis or ATN. Acute tubular necrosis is a medical condition involving the death of tubular epithelial cells that form the outer renal of tubules of kidneys. As we know, prior to pre-renal kidney failure, there is a condition or that it occurs due to substantial decrease in blood flow and blood pressure to the kidney. Whenever there is an insufficient blood flow to the kidney, this will lead to formation of ischemia or a condition of ischemia. And this ischemia will result in acute tubular necrosis. This is a sample drawing by myself to show an unhealthy nephron or a nephron which is suffering from acute tubular necrosis. Acute tubular necrosis where, in simple word, we can say the tubular epithelial cells are dying. So this is a sample drawing by myself. Renal tubular epithelium cells are dying due to ischemia after a longer period of time of insufficient of blood flow. So whenever there is a damage in epithelium cells over here, that will increase the blood urea nitrogen and creatinine level, as kidney wouldn't be able to reabsorb the blood urea nitrogen or excrete the excessive creatinine. There are also other causes of this dying of renal tubular epithelium cells, which are inflammatory issues and glomerulonephritis, which can cause intra-renal ARF. If the kidney is suffering from ischemia, as I say, insufficient blood flow to the kidney, which will result in acute tubular necrosis. Acute tubular necrosis is the death of epithelium cells. This will create an obstruction and blockage in the outer layer of the lumen. This obstruction and blockage in outer layer of lumen due to the death of epithelium cells that falls together, which will clump together and form a plug inside the renal tubules, which blocks the flow of fluid. And will create a back flow. Okay, whenever there is a back flow inside the nephrons, it will increase the pressure inside the nephron to reduce the glomerular filtration rate. So if there is an increase in pressure, reduce in glomerular filtration rate, the urine output will be very low. Now let's see about pre-renal ARF or pre-renal kidney failure. This happens due to the blockage in urethra or urethra. This usually happens after the kidney filtration, or blockage reduce filtration and urine flow. This can also happen due to the blockage in the exit or in the exit way of the lumen. This can also can be resulted from the death of epithelium cells. Now we can see the pre-renal kidney failure, intra-renal kidney failure and post-renal kidney failure are all related to each other. Now let's look at the post-renal kidney failure. There are few causes. One of the first causes can be said as spinal cord injuries might have damaged the neurons that responsible for detrusor muscle contraction of urinary bladder. So as we can see here, this is the urinary bladder. This is where our urine will be stored. Okay, so whenever our bladder is full, the neurons from the spinal cord, okay, will contract a little bit to let us know our bladder is full. So whenever there is a spinal cord injuries that could have damaged the neurons, which is responsible for detrusor muscle contraction of urinary bladder, will classified as neurogenic bladder. And also the failure of detrusor muscle contraction in the urinary bladder will create a backflow. So the flow of the urine will just go back to the kidney. So this will still going to damage the kidney. Another cause is enlargement of prostate glands, which compress the urethra that limits the urine flow. This also will form a backflow to the kidney, or other causes which can be said as kidney or renal stone. This kidney or renal stone will block the flow of urine along the urinary tract. So in easy words, for post-renal kidney failure, whatsoever the obstruction in the post-renal, the urine backflow in the nephrons will reduce the glomerular filtration rate. In other words, this will heavily affect our kidney. Thanks for checking out my video, and don't forget to subscribe for more videos like this. Until next time, keep crushing it, and we will talk soon. Bye.